It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Doc's Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Well, welcome back, Dr. Urse. This is another 7-minute drill, part of the Bone and Joint Playbook overall product that we have here going here. So welcome back.
Thanks, Terry.
And it is March, and we're heading into spring, and I'm sure a lot of people out there watching might have this following issue, and that issue is?
Well, this is called Sock-it to me. My shoulder popped out.
Sock-it to me. And that's a reference to laughing. Let's just give those folks our age.
If you're old enough to remember laughing, sock-it to me. This could be like a light socket, though, like S-O-C-K-E-T, where your ball of the ball and socket of the shoulder is now popped out or separated.
So not only do we have some great questions that we've kind of gone through here, we have a graphic, a visual aid. He's brought show and tell to us today. What is a popping shoulder? What's a popped shoulder? What does that mean?
Well, let's start with the shoulder itself. And remember, we did a podcast called My Collarbone is Out of Place or Separated.
Yeah.
So if we look at the collarbone, you can feel your own collarbone on the top of your chest wall, and it comes over, and on the top of the shoulder is called the AC joint, where the collarbone meets the shoulder blade. We already talked about that. That's when it gets injured by a blow on the top. An arm injury to the ball and socket is the actual shoulder joint itself. And that joint is a very mobile joint. It moves in 6 different directions. It lets us climb trees, throw a baseball, do gymnastics. So that freedom of movement is really good because it's not a real deep socket like a hip.
Right.
But the fact that it's much like a basketball and a dinner plate, it doesn't have that deep holding pattern. If it gets injured, the ball can slip out of place or pop out of joint, and then when it pops out of the socket, it can either pop out part way, and that's called a subluxation, or it can pop out all the way, and now it's not in the joint, and now it hurts, and you're going to look for help to get it back in. Think of a train on a track. We've all had little toy trains.
I like to think of trains all the time.
But if the train jumps the track a little and the wheel goes back on, that's a part way jump off the track that kind of shifts off and on.
So is this a common thing?
That's a partway separation. But yes, in certain people, and we'll talk about who's at risk for this injury, athletics, obviously trauma, when you get your arm jerked backwards, or what if you're just a loose-jointed person? Some people can straighten their elbows and over-straighten them, or over-straighten their knees.
So that's
there's things called EDS that are congenital or genetic problems, where these are very loose-jointed people. You've seen some of the gymnastics people who do some things, or the contortionists that are shooting their bow and arrows on, The Voice or those different shows on TV. America's Got Some Kind of Talent. So there are reasons some are more loose jointed, but also we play a lot of sports that could get lacrosse, soccer, football, throwing baseballs, anything that forces the ball out of the socket.
Throwing a baseball.
It usually isn't going to be one throw. It's going to be, some of these are traumatic injuries. You go, I know exactly when it happened. Another one may be a recurrent microtrauma where the structures that hold the ball and socket gradually get stretched or torn. And there's 2 main things we'll talk about today. One is the lining of the shoulder called the capsule. The capsule is like a sack or like your purse. It's very rigid. It holds all the things you carry around.
Right.
But the other thing that holds the socket in a good position is called the labrum or the lip. And the lip is like a gasket around the shoulder. And when the labrum tears, then the shoulder can slip out of place. And that leads to what's called shoulder instability or shoulder partway or full dislocations.
Now, I've seen wrestlers like in a wrestling match. something happens, they go to the coach, and the coach just kind of does one of those things. Is that
right?
is
Well,
that
again,
right or wrong?
it's probably what we're going to talk about too. Is like, well, how do you know your shoulder's out of place?
Yeah, how do you know?
Well, first of all, it hurts because it's not in where it should be, so it's
Sure.
out of place. Dislocation means you're not in the right location, right? So if your hip pops out of place, you're not moving because it's locked out of place. It's a deeper socket.
Yeah.
A knee, we're going to talk a little bit about kneecaps popping out of place later. So joints are meant to smoothly glide back and forth. We talked about arthritis when they wear down and get wear and tear inside the joint. This topic is unstable or unhappy joints because they're not across from each other. The joint is now the ball has jumped out of the socket. It can go most of the time forward. If it does, you might have a bump or the ball is actually sitting in front of the shoulder blade.
Yeah.
And there are ways, because it's such a shallow joint, that you can jiggle your arm a certain way and pop it back in.
Does it make a noise?
It can, and you can have certainly a healthcare provider at an emergency room give you some sedation. They can give you a little muscle relaxation. Sometimes they gently bring the arm forward, or they put counter traction on the arm, or they lay you over a table to try to get the arm to go back in. Once it's back in, it's going to be a lot happier because it feels better.
So if it goes in, let's go back to the wrestler. Coach pops it back in. Is he good to go back out there, or should he not?
He's not going to be very good because he's going to be at a high risk to have it happen again with the first stressful force.
Yeah.
So we're going to talk about, well, what happens to people who get this problem, and are there certain people that are predisposed to it? We talked about loose jointed people, but an athletic teenager who dislocates or injures his shoulder has about a 75 to 90% chance it's going to keep popping out.
Really?
And that's not good for a couple reasons. One, you're scuffing the cartilage, which is the cushion between the bones, between the ball and socket. You're also potentially injuring nerves that are around the shoulder. Some people, their arm slips out of place when they sleep. They get a dead arm feeling. It's the ball part is actually sitting on your nerves that go down into the hand. So I ask my patients, do you ever get a dead arm feeling at night? And they go, yeah, my arm feels asleep, but I've had a nerve test, it's normal, and I jiggle my arm a certain way and it feels better. Well, the ball's jumping the track, it's partway slipping out,
Yeah.
It's going back in, and then you're living with a unstable shoulder, and then it's up to us as a healthcare provider to make a diagnosis using testing. We start with plain x-rays, and that will show us there are some fractures that occur. When the ball bangs against the socket, you can chip a piece of the ball. You can bang a piece of the socket off, called the lip of the
and the
bone.
ball's this thing right here.
Well, the ball is the ball, called the humerus.
Yeah.
The socket is the scapula or shoulder blade, and it's a little round, almost a 50-cent piece. So it's not a real deep structure. And once the x-ray says, well, there's no fractures, that's good to know. You may still need an MRI test to see, did you tear that labrum, which is that thick gasket that holds the ball in place. And if the labrum's torn and now you've popped this shoulder out a few times, the lining gets stretched out.
What's the labrum right here?
Well, the labrum isn't visible on this model because it's around the socket. Think of a curb or a fleshy little lip that circles the socket of the shoulder. The hip has a labrum. We're going to talk about labral tears of the hip someday, but it's much like a weight-bearing shoulder. The hip's very similar to shoulders in some of the anatomy and some of the injuries we get. But what we want to know is, what's the problem? Is it going to get better without surgery? So we actually encourage people to try therapy. We have some exercises we use with our tubing exercises down with the elbow at our side.
Here, I'll try to.
We'll
take a picture of that. Yeah, I'll put a
we'll
picture
put this
of that
up for people to look at.
Right.
But your therapist will encourage you to keep the elbow by your side and do rotation maneuvers to strengthen these muscles. So look at the front of the shoulder. These red muscles are called rotator cuff muscles. They rotate, but they also stabilize and hold the shoulder in place. By strengthening those, that helps support and maintain the shoulder alignment. So you may have a loose shoulder that gets better with therapy. We also want to avoid things that make it worse. Getting like a bench press or a butterfly curl in the weight room.
What about pickleball? I mean, pickleball, because that's where I normally
it's going to be problems if you're going overhead for serves or hitting an overhead shot, because you're taking the arm in that kind of throwing or what's called a waving position.
Right.
Those are vulnerable positions for shoulders. When we injure the shoulder, we'll ask people to wear a sling for about 3 weeks to let the tissues heal. Much like any injury, you want to give the body a chance to let everything tighten up. And stretching it out more by moving it isn't letting the body heal it. So we get Billy out of the wrestling room, get him off the baseball field, tell people let therapy try to get this better with what's called conservative measures.
Right. So is the surgery you do, what do you do when you do a surgery to repair it? What is...
Well, that's a great question. So first of all, you have usually a younger population, and we talked about how high the risk is to have it keep popping out, right? Almost 90% if you're 20 years old.
So if it happens when I'm 20, it's going to keep on happening.
It's going to keep happening 9 out of 10 times, and you're going to be better off fixing it sooner than later for 2 reasons. You'll have less damage to the shoulder, plus it's easier to fix something that's recently injured than something that's been stretched out more.
But can I wear like something if I know I have shoulder issue?
There are some wrap? Sleeves that go across the shoulder and swath over to the chest wall. There's a device, like it's called an Omo train. It's a silly name, but it's a garment that actually you would wear underneath like a tight stretch shirt, long sleeve shirt, and it actually holds the shoulder or reminds you not to move it much. But the bottom line is, if you're older, we talked about things that are good as you get older, not just wines, but also shoulders have a less likely chance to pop out at our age. They're probably 1 in 3.
Why?
As we get older. Well, our joints are stiffer, and they don't stretch out as much, and they recover better from a wobbliness injury like a dislocation.
So you're saying being older is better in this situation?
In one of the few things in life, yes.
Okay.
So I think if I go back to your question about what does a surgeon do for your problem, we recognize, number one, what's the problem? Is there a fracture with it? We have to address the fracture if it's making the joint unstable. You may put the little piece back to restore the anatomy of the shoulder. Most likely you're going to realign that bumper called the labrum, fix the labrum back to the socket so it forms a buttress to keep the shoulder from slipping out.
How do you fix it? Because you stitch it up?
We use stitches and little things called anchors that go into the bone. And I always tell people they're much like a tent stake that goes in the ground.
Yeah.
You have a rope that goes up to your net, and that holds the rope, right? That thing planted into the ground. Well, we put those in much like a staple gun on a screen door. We tack it back. We also would sometimes take a tuck in the lining called the capsule. We talked about the stretched out part of the shoulder after usually multiple injuries. The surgeon may take sutures and actually take a tuck in the lining, like you take a tuck in your hem of your pants. So the surgeon is going to address where the problem is, most of the time with a scope, with little holes. You don't have to open up the shoulder. In the old days, Hippocrates used to get called when shoulders popped out, and after enough times popping them back in, they'd hang the arm over a ladder rung or some crazy thing. He would just take a poker from the fire and scar it into the shoulder so it wouldn't move. And it was barbaric treatment, but it kept him from waking up at night. So
you're talking about the guy with Hippocratic Oath guy. Right?
Yeah. He was like one of the few docs in the old days, so he was on call. He had the first. I think he had the beeper, the first beeper. But then they used to open up the shoulder, and then they would tighten the muscle so much you couldn't move the arm. Well, that kept it from popping out, but it didn't really restore your function.
Yeah.
Now we go into the joint, we fix the problem, so the arm gets back to normal or near normal use. These are bad injuries if you're a baseball pitcher or a person who relies on a certain amount of what's called rotation of the arm and the velocity of a pitch.
So if there's somebody out there watching and they're saying, I'm not going to go to the doctor, are there home remedies?
Well, no. A shoulder that's unstable does not fix itself. So you're not doing your shoulder a service. We've put shoulder replacements in 40-year-olds who have had multiple in and out what's called dislocations
Yep.
of their shoulder because they're beating their cartilage. Think about just banging your hand against your fist. You're injuring the surface that forms the shoulder joint. And the worst thing you could do is show people at parties, oh, I can pop my shoulder out. I don't know if you saw the old Lethal Weapon movies. I mean, if you're in a straitjacket and you got to pop it out to get out, that's one thing.
But aren't those contortionists doing that on stage?
Those people are loose jointed. We usually don't even work on those people because they're so loose jointed, they will probably pop your shoulder surgery out after you do it. So we try not to work on things that are very difficult.
Is that a question you asked? Are you a contortionist?
No,
Before surgery?
we actually do a test of how their elbows and knees straighten. Can they bend their thumb back? Can they bend? Like, can you stand up with your knees straight and touch your palms on the ground? And you'd go, hell no. Well, the answer is those people really easy. Wow. So we give them a score. It's called a flexibility score. It's called a Baton score. So it's a number out of 9. And if you're an 8 or a 9, you're really loose jointed. You better think twice about doing hip or shoulder surgery on those people because they have a genetic predisposition to loose jointedness. And it really affects kind of the hips and shoulders the most.
So people playing tennis, pickleball, football, things like that at a younger age, this is could be a very common thing.
Oh, it is a common thing. And again, it's something we want to avoid. It's not common. It's really a forceful injury to an arm, usually an arm that gets jerked out.
Yeah.
And it's think of putting your arm out and hitting a mailbox or something. That would torque the arm, and that may tear that labrum or capsule. And, some of these are forceful injuries. They can be with fractures, as we talked about that. But some are smaller injuries over time that we call that repetitive microtrauma. So you need a diagnosis like any medical problem. You need the right imaging to see what it is. You need to try simple things first called therapy, conservative measures, avoidance of problems that cause it, and then see how you are. If you're not better, then find a shoulder specialist who can stabilize your shoulder because you're going to need it the rest of your life.
Yeah, so that labrum, just last question before we
labrum, yep.
Labrum, sorry. Does it heal? Like if I pops out, I put my thing in a cast, I'm good, I don't move it for 3 weeks. Does it heal?
It has a good chance to heal. And I'll give you one interesting aside from that. Everybody puts an arm in a sling because that's what every emergency room has or urgent care. The Japanese have found that by turning the arm out like you're going to shake hands, it pushes the front rotator muscle against the front where the injury is, and it actually holds it better for 3 weeks like this. So they would put a splint or a cast across like this and have you walk around like you're shaking hands for 3 weeks because it holds the front of the shoulder tighter. So I actually put my patients in a little thing with a breadbasket foam sling
I've seen those,
that holds the arm out here instead of across. But again, most people in emergency rooms aren't aware of the Japanese studies on how younger people, and in those cases, some of the younger under 20 age patients had 10% dislocation rates afterwards instead of 90, which is really good. So we always want to try letting the body heal something with the proper positioning or therapy or protection.
All right, so that's probably the last question I have. Have I left anything off that we should probably be sharing with these folks?
Well, no, I don't think so. I think you don't want to ignore a shoulder that's not stable or that's popping out of place.
And it does hurt when it happens.
It hurts because it's not located. That's what the word dislocation is, right?
Yeah.
And even if it's partway slipping out, it never feels right because it jumps the track. We talked about that.
Oh, I think I feel okay. I keep diagnosing myself during these conversations, by the way. So that has been it for the 7-minute drill with Dr. John Urse, talking about popping shoulders. We're going to name this. What's the title of this one? We're going to say, what's popping in your shoulder?
Sock-it to me. My shoulders popped out.
I knew it was clever. Okay, folks, that is it for this episode. We'll see you again real soon.
We want to thank our sponsors, too. Ted's Dressing.
God, please go ahead.
And GWR Group, financial consultants at Stiefel, Guy, Brad, and Jeff Richardson. And their contact information is on our podcast site, the Bone and Joint Playbook. Be sure to like us on your social media sites and ask a friend to take a listen.
All right, folks, that's it. We'll see you again real soon. Bye.